Welcome to A18 Telangana News. Fasting tips for diabetes patient and what are the risks involving in it, and also advice to use good quality mask to prevent from COVID-19 by Dr. Aslam Khan, orthopedic. A18 Telangana News Bureau.
Some of the few important health tips for diabetes patients during fasting in Ramadan. As you all know, Ramadan is a month where fasting is very useful and beneficial for many of the patients. But it is essentially required that diabetes patients during Ramadan, these things that the risk factors may be present for them. Some of the important risk factors for diabetes patients are hypoglycemia, that is low blood sugar levels. Low blood sugar levels during fasting is an important aspect where diabetes patients need to be looked after. The symptoms of low blood sugar levels are sweating, tremors, that is shaking of the hands, and palpitation, that is one can hear their own heart sound, are the important things which need to be looked after. And if these things appears frequently, then they must get regular blood sugar levels checked and consult their physician or endocrinologist. Another second important risk factor of diabetes patients are hyperglycemia, that is increased blood sugar levels. The symptoms of increased blood sugar levels are increased thirst, going to the bathroom more frequently, and these things need to be looked, and these things are to be get treated and in diabetes patients. The third important risk factor in diabetes patients are dehydration. The symptoms of the dehydration are the increased thirst, and there is a dryness of the lips, mouth, face and skin. These things have to be looked in the diabetes patient. So the other common things that the diabetes patients need to be looked after is the foods that need to be followed and the foods that needs to be avoided. So the common fruits that need to be taken by the diabetes patients during Ramadan is apple, guava, papaya, pear and pomegranate. And the fruits that needs to be avoided in diabetes patients are banana, mango, custard apple, grapes. These are some of the foods which I told you regarding the fruits. And vegetables that need to be taken and that not to be taken by diabetes patients during Ramadan are the foods which are to be taken are all green leafy vegetables can be taken by diabetes patients. And foods that need to be avoided, vegetables that need to be avoided during Ramadan by diabetes patients are potatoes, colocasia, cauliflower, radish and cabbage. So in general, what we need to know about the diabetes patients during Ramadan is you need to take foods which are causing less sugar levels, increase in the less sugar levels. Avoid the foods that causes increased blood sugar levels. So at the end, I need to conclude that the diabetes patient should ideally be monitored 2 months before Ramadan, starting of the Ramadan, or else if not, then they need to consult their physician or endocrinologist just before the start of the Ramadan and follow these things, particularly the hypoglycemia, the most important risk factor associated with the diabetes patient during Ramadan. So in general, for other people, generally these other things due to this coronavirus crisis, this need to be followed are avoid shaking hands with the other fellows and avoid meeting, gathering, maintain social distance. Wear face mask regularly when stepping out of the home if required. Washing hands regularly for about 2 minutes, or else you can use alcohol-based sanitizers. And in order to avoid this so at the end I want to conclude that as Ramadan is going to start from tomorrow onwards, every Muslim and also non-Muslim, this needs to be followed up. Like they have to stay in the home and do ibadah at home only and make du'as to Allah that inshallah this thing will go and inshallah this thing should go, as this is the most critical time for many of us facing this many issues with the coronavirus disease. So I want to tell all the people of the India and also the people of the Hyderabad that these measures should be taken strictly and follow these things strictly, and inshallah we can surely achieve success and we can eradicate this coronavirus disease, inshallah. Thank you.